Thank you for joining us this morning. My name is Karen Curtis, and I'm a member of the Provider Outreach and Education team here at WPS Government Health Administrators. I'm joined today by my friend and colleague, Aline Sigler. She will be monitoring the chat for questions, as well as providing some additional information from time to time. Over the past few months, we have been doing the preventive services as a series. So each month I pick a couple topics and cover those. And I do the billing portion of it. And we also have a member of our clinical staff who has been doing more of the clinical portion, like documentation needs, things like that. So the webinar today, I am going to be covering glaucoma screening, and I'm going to be talking about the billing aspect of it. This next slide is our disclaimer. We do our best to provide the most current, accurate information, but as we all know, Medicare rules can change often. The information that I am presenting is accurate as of today, but the CMS website should be checked often for updates. CMS does prohibit the recording of this webinar for profit-making purposes, so we ask that you don't record the presentation or take screenshots. This event is being recorded by us, and we will post it to the WPS GHA website, on the Encore Presentations webpage, as well as to our YouTube channel. We have started to add a CPT copyright notice. This is something that now has to be included in any presentation, which includes CPT or HCPCS. And since I'm describing how claims should be billed to Medicare, this presentation does include slides that will have a CPT or HCPCS code. So just want to let you know that this is the copyright notice for that. Now we can move on to what I'm going to talk about today. I'm going to start out with some general information about glaucoma before moving on to coverage and billing. And then lastly, I'm going to discuss checking eligibility, and that way that can help you avoid any frequency denials while submitting your claims. Here's a list of acronyms that I've used in today's presentation. If I use something that you're not familiar with, then please refer back to this slide and hopefully that will help you. So first, we're going to start with a little information about glaucoma. Glaucoma is a disease that damages the eye's optic nerve. If left untreated, it can lead to loss of vision and blindness. Scientists haven't determined what exactly causes glaucoma, and the only way to know if you have it is through a comprehensive dilated eye exam. Symptoms can start slowly, so some of the individuals may not notice the changes in their vision. Loss of vision usually begins with peripheral vision, especially the part of vision closest to the nose. And as the disease gets worse, patients may notice that they can't see things off to the side anymore. Glaucoma does affect around 3 million Americans, and it is the second leading cause of blindness worldwide. Currently, there is no cure for glaucoma, but if it's caught early, treatment can help prevent sight and can help preserve sight and prevent further damage. The most common forms of treatment are medicine in the form of prescription eye drops. These can lower the pressure in the eye and prevent damage to the optic nerve. Laser treatment is another option. This procedure can help drain fluid from the eyes, which will lower eye pressure. And finally, if the eye drops and the laser treatment don't work, then surgery may be an option. There are a few different types of surgeries that can be performed to help lower pressure in the eyes. Although these procedures can't cure glaucoma or restore vision that has been lost, it can help the situation from getting worse. Some risk factors for being more susceptible to glaucoma include individuals who are of Hispanic or Latino heritage that are over the age of 60, patients over the age of 40 who are of African American descent, and those who have a family history of glaucoma. So now let's move on, and we're going to talk about the coverage for glaucoma screening. I wanted to start out with the CMS definition of glaucoma for glaucoma screening, and this is taken directly from the Medicare Benefits Policy Manual, which is publication 100-2, Chapter 15, Section 280.1. So screening for glaucoma is defined as a dilated eye exam with the intraocular pressure measurement and a direct ophthalmoscopy examination or a slit lamp biomicroscopic examination. According to the Benefits Improvement Act and Protection Act of 2000, annual coverage for glaucoma screening is covered for beneficiaries in the high-risk categories. So that would include individuals with diabetes mellitus, individuals with a family history of glaucoma, and African Americans age 50 and over. In 2006, a revision was done to add Hispanic Americans age 65 and older. Examinations must be furnished by or under the direct supervision of an ophthalmologist or optometrist, and it must be in an office setting. This is a service that can be performed annually, so at least 11 months must have passed following the month in which the last exam was performed. So this means if the beneficiary received a glaucoma screening examination in January of 2024, you're going to start counting the 11 months in February. So this would make them eligible for their next examination in January of 2025. Deductible and coinsurance do apply to this service, and I realize that that's something that's a little different for most preventive services. And the reason that that is there's a group called the U.S. Preventive Services Task Force, and what they do is they do studies and they examine all of the preventive services and then they grade them. So if a service gets a grade of an A or B, then Medicare would have to waive any coinsurance or deductible that would be applied. Now, for glaucoma screening, they have ranked that as an I, and that is the lowest on the task force grading scale. So because of that, deductible and coinsurance do apply to this service. So now let's get into what you need to put on the claim to submit it to Medicare. There are two codes that can be used when billing this service. The G0117 is when the screening has been completed by the optometrist or the ophthalmologist. Code G0118 is if the service was furnished under direct supervision. And I've kind of done a little bit more checking to see exactly what they mean by direct supervision. And what I found is that it means that the optometrist or the ophthalmologist is present in the office suite and that they would be immediately available to furnish assistance or direction throughout the performance of the procedure if they're needed. But it does not mean that they have to be present in the same room as the examination is being performed. The claim should include diagnosis code Z135. And if you're a provider who bills using the CMS 1500 or the 837P equivalent, then the type of service is going to be a Q. If you are a provider who bills on a UB04 or an 837I equivalent, I've provided a list of the applicable type of bills. So here you can see that this service can be billed by a hospital, a skilled nursing facility, a rural health clinic, federally qualified health clinics, a comprehensive outpatient rehabilitation facility, or a critical access hospital. I want to talk a little bit about the revenue codes that should be used on specific types of bills. So if you're a CORF or a CA or a SNF and you are billing on a type of bill 75X, an 85X or a 22 or 23X, then you're going to use revenue code 770 to report these services. If you are a Method 2 CA, then you will be using revenue code 96X, 97X, or 98X. Hospital outpatient departments can use any appropriate revenue code on their 13X type of bill. If you are billing from a rural health clinic or a federally qualified health center, payment is included in the all-inclusive rate. So in the past, screening glaucoma services had to be billed with a revenue code 770, and then a separate related visit would have to be reported with a revenue code 520 or 521. These requirements were removed, and additional revenue codes are no longer required. So the services can just be billed using revenue code 520 or 521, just whichever one is more appropriate. The last topic I'd like to talk about today is eligibility. So checking eligibility before providing these services is going to help avoid frequency rejections. We have a few options for checking patient eligibility. The first is the Interactive Voice Response System, which is known as the IVR. And when you call that, you can simply say eligibility. And then after providing some of the beneficiary's information, Preventive Services is going to be one of the information choices that's available. If you have access to the WPS portal, which can be done through our EDI department, then under the Preventive Services tab, you'll be able to see if the patient has already received this service. For providers using the FIS system, you can request access to the Direct Data Entry System, which is known as DDE. And this is going to allow you access to the beneficiary's common working file records. So there's literally going to be 16 pages worth of eligibility information. It has a bunch of services listed. It tells you when the beneficiary got those services, and in some cases it would tell you when their next eligibility date is. And the last option shown here is the HIPAA Eligibility Transaction System, which is known as HETS. This requires providers to register as a trading partner with our EDI department. And after that's been set up, then eligibility information is received by you, the provider, submitting a 270 electronic inquiry file, and the system will provide a 271 response, and that will have information regarding eligibility for the screening services. This last slide is a list of resources if you would like to get some more information on any of the topics. I did include a link to the Medicare Preventive Services tool just because I find that helpful regardless of which preventive services that you are looking for. One of the resources that was left off was the Medicare Benefit Policy Manual, so I apologize for that. It is publication 100-2, Chapter 15, Section 280.1. I'm going to go out there just real quick. Aline, can you verify that you can see the CMS manual?
I see the table of contents.
Okay, great. So we'll go to glaucoma screening. And this does provide you with a lot of information. It gives the conditions of coverage, tells you how to bill for the services, talks about calculating the frequency, diagnosis code requirements. It goes into payment, which I did not cover, but this would give you more information on that. Special billing instructions if you happen to be a rural health clinic or federally qualified health center. While I'm out here, I'm also going to take you to the Medicare Preventive Services tool. This, if we click on glaucoma screening, this would give you the codes that should be used. It gives you the ICD-9 codes if there is a requirement. Not all services require a specific diagnosis code, but this one does. It tells you what Medicare covers. Now, down here, they did link to an article on glaucoma screening. So if we click on this, it does take you to the Medicare coverage database. Now, it does let you know this article is not related to an LCD. And this was actually, if we look, this was actually written by Palmetto. But I wanted to let you guys know about it because it does contain a lot of good information. So that's just another resource that you can use that may help you. Now, before I ask Aline if any questions have come through the chat, I did have a couple pre-submitted questions that I'd like to address. The first question I was asked is that if the screening applied to a patient that was already diagnosed with glaucoma. And so what I did when I was kind of looking at this is I went to the Federal Register. When I looked in here, screening for glaucoma, it said that it means that the procedure is furnished to an individual for the early detection of glaucoma. So I'm not exactly sure what situation this particular provider has, but since it's saying that it's to detect early, since it's for the early detection of glaucoma, I don't know if somebody who's already been diagnosed with glaucoma would meet this requirement. I can't say yes or no. I can't say that we absolutely wouldn't pay for it, but by looking at the regulations, this screening is geared more for detecting glaucoma in somebody that has not already been diagnosed. Now, the other question that I received, I was asked if 2 or more ancillary tests could be performed on the same day for the same diagnosis. And I don't know if the person that submitted this question is in attendance, but there just really isn't enough information for me to answer this question. So I would suggest calling customer service to get assistance. I'm not sure what type of provider this is or what type of services they're talking about billing for. So I just feel like customer service would probably be the best option, and they could look into it and help you with that. Now, that was all that I had for pre-submitted questions. So I'm going to ask Aline if anything has come through in the chat.
Thanks, Karen. Thanks for that clarification and those questions and that great information. We do not have any questions in chat at this time.
Okay, great. Thank you so much. So this brings us to the end of today's presentation. On behalf of myself, Aline, and Provider Outreach and Education, thank you so much for joining us today. We look forward to your survey comments and hope that you will join us for future events.